Hondurans are not the only ones dealing with problems with their health system. Our correspondent in Peru now, Rael Mora, tells us how the government there is also looking to shift money away from the public sector.
Public sector medical doctors are denouncing the request by the executive to get decree powers from Congress to further finance public hospitals to perform public health services. They claim that a scheme called public and private associations has already meant the deterioration of the public health system called EsSalud. Under the public-private partnership started in 2014, the state redirects $68 million a year to each private hospital, which for many has not meant an improvement in services.
The waiting lists continue to be long. In other words, patient services have not improved. Therefore, there is no evidence that these associations between the state and private entities have served the public health system. In fact, it undermines it because it takes resources from the public sector and only treats simple procedures.
The public health system is left then to deal with expensive and complicated treatments like that for cancer, HIV, and diabetes. These public-private partnerships in hospitals are attempts to revive investment in the Peruvian economy. However, analyst Giancarlo Castiglioni believes that at best there is a lack of regulation for these hospitals, and at worst, such attempts are disguised as ways to privatize services.
The logic of promoting public and private associations is ideological. They believe that only the private sector can do things with efficiency. Therefore, the public sector must not operate services. Only the private sector should.
These associations between the state and private entities were started for infrastructure works in 2009, but are now expanding to services such as health. Since many consider such services as basic rights, further privatization is likely to cause social conflicts and government discontent. Rael Mora, teleSUR, Lima.